Today we're going to talk about the baroreflex. The baroreflex is something that we undergo all the time in regular everyday life. You just don't think about it. So I'm going to give you an example here, and then we're going to talk about how the brain, and specifically both branches of the autonomic nervous system, will deal with this situation. March Madness starts this week. I am going to spend an inordinate amount of time on the couch watching basketball. Okay, I'll be doing a little bit of work, but mostly I'll be sitting there watching basketball. Now, inevitably, there will come a time where I'm thirsty or hungry or whatever, and I want to get up from the couch and I want to eat something or drink something. And so I will jump up off the couch. Inevitably, this will cause me to become lightheaded. I've got really low blood pressure and I've got a really low heart rate. And so I come close to passing out quite often. All right, so we're going to say I just stand up. Okay, this results in my blood pressure going down. Okay, now I want you to think for a minute, what does my brain want to do now that blood pressure is low? Now it knows that blood pressure is low because the firing rate of my baroreceptors is decreased. Decreased firing rate of baros. So what does my brain want to do? Well, obviously it wants to increase my mean arterial pressure. It wants to get it back to normal. So it can do this by using both branches of the autonomic nervous system. So we're going to come over here and we're going to talk about the parasympathetic nervous system. And then we're going to come over here and we're going to talk about the sympathetic nervous system. Okay. If I've got low pressure, I want my parasympathetic nervous system to turn down. I want my sympathetic nervous system to turn up. Now there are three variables that we can directly affect which will lead to a change in blood pressure, into mean arterial pressure. Okay, now if you recall from previous videos from what we've discussed in class, the parasympathetic side can only affect one of these variables. And so it can only affect heart rate. And so it does this by affecting the SA node. So if we decrease parasympathetic nervous system, what we do is we actually we increase the firing rate of the SA node. Now the parasympathetic side does this, so we're going to close calcium channels. So we want to decrease that potassium efflux. We're going to talk about how the sympathetic nervous system also affects heart rate in just a second. But ultimately what this does is this leads to an increased heart rate. Okay? It doesn't have anything to do with any other variables. The parasympathetic side doesn't deal with the other two variables. Okay, so now we're going to come over here. The sympathetic nervous system also increases the firing rate of the SA node by increasing its activity. So in this case, the SNS will actually increase sodium influx. And this leads to an increase in heart rate. Okay, so that's one variable. So the next, we've got stroke volume. And so what we do here is we increase ventricular contractility. Okay, in other words, we're making the ventricles, or allowing the ventricles to contract harder. And how do we do this? Through increased calcium influx. So what's this do? This increases stroke volume. Now, if we take these two together, what we're doing is we're increasing cardiac output, which is often labeled as QC. Now, there's one other variable that the sympathetic nervous system can affect, and that's resistance. And what it does is it causes vasoconstriction. Okay? What this does is this leads to an increase in total peripheral resistance. Okay, basically what we've done is we've taken our straw that we're drinking our shake with, and instead of having a fat straw, now we've got a skinny straw. Okay, in order to continue getting shake out of our straw, we have to generate more pressure. Now what's really interesting is that cardiac output directly increases systolic blood pressure. Total peripheral resistance, on the other hand, increases diastolic blood pressure. Remember that systolic blood pressure is caused by blood leaving the ventricle during contraction. Diastolic blood pressure is caused by the elastic recoil of the arteries that occurs during ventricular relaxation. Okay, so the vessels, the arteries, expand out during contraction, and then when the contraction goes away, they recoil like a balloon, which continues to push blood forward. And so resistance has everything to do with diastolic blood pressure. Well, if we increase both diastolic and systolic pressure, we're going to increase mean arterial pressure. And as a result, we increase it back to normal, and we've got a negative feedback loop. And so pressure will go up to normal or get increased back to normal, and then we will stop with these changes that we've made in order to maintain mean arterial pressure. A couple other things I want to add here just as I'm thinking about it. So when we vasoconstrict, we're activating alpha receptors on the arteries, or actually on the arterioles. And then on the ventricle and on the pacemaker cells, we're actually activating beta receptors. And we'll talk more about these in class. So quick recap. I stand up, my blood pressure is low. My brain understands that blood pressure is low because the baroreceptors are sending fewer action potentials. So as a result, it increases the increases the sympathetic activity, decreases the parasympathetic activity, ultimately increasing heart rate, stroke volume, and resistance, which will increase systolic blood pressure as well as diastolic blood pressure, and that will increase mean arterial pressure.